how the nodule really developed, but as a child, I was very young, probably 6 or 7 years old. My sister was watching a scary movie one night, and I was doing some drawing, and I had a ruler, one of those rulers that we used in school. I got up and ran from the scary movie, and I put the ruler in my mouth.
Yeah.
I ran into a wall, and so it cut the roof of my mouth. So as I grew, there was a lump that grew in the roof of my mouth. But in just the last 5 or 6 years, that's become more like a nodule there, and it's been very painful. And I've noticed since the laser treatment that it has reduced in size. So I think I'm just positive that it has helped that as well. There's still quite a lot of pain in the roof of my mouth, but I know the size of that is reduced. I believe I was holding the upper cervical adjustments much better and much longer with the laser treatment than prior. There were a few times that I had to go 2-3 times a week for the upper cervical adjustments prior to the laser. And then I noticed I would be holding for my next 3 or 4 day visit and hold up to a week, which was very uncommon for me at that time. It usually takes several months with an upper cervical doctor to get me where I'm holding for a week. So I do know that the laser is very helpful with that.
And did you tell me that you were able to stop 2 of your medications? Did you text me something about that?
I think I did. Right now I can't recall the names of the medications that I was taking at the time. I know I stopped the antibiotic treatment because I wanted to know for sure that the antibiotics were finished and they were out of my body. I had been taking Flagyl, and I know that was when I stopped. That was oral, and I was given doxycycline for an upper respiratory infection, and I finished that before I started the laser treatment as well. So I believe those 2 might have been the 2 that I had told you I stopped.
I think it was. That sounds right.
And I had prescriptions to continue the IV antibiotics that I had been given in the acute care hospital. I was there 5 weeks and had the Ceftin IV every day, 3 times a day. There were, I believe it was 4 more that were prescribed for me for 4 weeks at a time. So that would have been several months of the IV antibiotics. And at the time that I had gone about 2 weeks into the laser treatment, I knew I would not need those antibiotics. I just knew from the improvement that I would not need to go on and have the IVs after that.
Okay. Do you want to rest before we go eat? Would that help you if you laid your head down and put your knees?
If I could lie down for just a few minutes.
I'm thinking that.
If there's anything else you want to record, I mean, we could, but you definitely want to do anything you